guidelines set out by various colleges of physicians and so on that were felt that they needed to be placed there because somehow hormone replacement was something that was dangerous to women. And so for a while it was don't use hormones at all. Then, all right, fine. If you need to use hormones, you can, but use the lowest dose for the shortest amount of time period.
Mm-hmm.
And then they changed and said, okay, fine, you can use the hormones, but not for more than 10 years. And that's kind of where we are now with the guidelines. But the thing with the guidelines is that they're fear-based and they're ultra conservative. And I just always ask, what is everyone so afraid of? Okay, so they're afraid that somehow women are going to have blood clots. Have we seen a huge number of women dying from blood clots on HRT? No, we haven't. Are they afraid that women are going to suddenly develop heart disease? Well, the data clearly shows that estrogen is protective to the
That's
heart. It
right.
keeps your
Yeah.
blood pressure low. Just like you pointed out, Kamisha, when you don't have estrogen, your cholesterol, your lipid profile changes.
Wow.
And you lose the protective benefits of the estrogen on how the liver is producing cholesterol. When you don't have estrogen, your bones are no longer being remodeled to make new bone and they become more brittle. There's fibers within the bone that are very elastic that allow your bone to have flexibility. If you don't have flexible bones and you fall over, they're going to snap. So estrogen is very important, as is testosterone, for constant new remodeling of bone. We know that estrogen is extremely protective to the brain. And when estrogen is taken away, we see the development of Alzheimer's plaques. You're familiar with the plaques that are seen in that disease. There's less blood flow to the brain. Sometimes small strokes can happen in the brain. We have this condition called multi-infarct dementia. Who gets dementia more? It's women, not men.
Women.
Because
Yeah.
of lack of that protective effect of the estrogen.
Yeah.
And finally, the genitourinary issues. I'm talking about all the vaginal discomfort, infections, the urinary tract infections. Women in their 80s often die from urinary sepsis,
Yeah.
which is tragic, and it's completely preventable with estrogen replacement, whether it's total body estrogen replacement or we're just using some estrogen around the vagina to protect those tissues. At the very minimum, that's what we should be using. So I really wonder what everyone's so afraid of. And I
Hmm.
think that it's just been this perpetuation of these myths that somehow this is dangerous for us when we have all the evidence that it's protective.
Yeah.
And even the Women's Health Initiative said in the group that was treated with estrogen, beginning in their 50s, compared to placebo, they had a reduction in all-cause mortality of 30%. There's no other drug that does
Yeah.
that. I've been a
No,
doctor
there isn't.
for a long time. There's no other drug on the market that can make that claim. It's crazy that everyone's so afraid of hormone replacement. So I never tell women to stop when they reach the age of natural menopause. Why would you want to? That's when I'm putting most people on HRT. Is
Yeah.
when they get to the age of natural menopause.
Uh,
And
Yeah, I mean, that makes sense. Yeah,
I'm
that makes
telling them
sense.
to stay on it.